President Barack Obama spoke to the nation by way of a speech to a special joint session of Congress. The purpose? To resuscitate his health care takeover plan that suffered a major setback during the bruising congressional recess. Opposition to the president's efforts has steadily increased as the details of the plan have been publicly examined. In the message that sounded more like a campaign stump speech than a concrete policy explanation, the president accused critics of the government takeover of using scare tactics and spreading misinformation. But he also said this.
And while there remains some significant details to be ironed out, I believe a broad consensus exists for the aspects of the plan I just outlined.
Never has the old adage, the devil is in the details, had more meaning. The president said he wanted to clear up the misunderstanding that under his plan, no federal dollars would be used to fund abortions. Well, allow me to address one of the details. The health care bills will fund abortion unless it is explicitly excluded, and the CAPS amendment explicitly included government funding of abortion. To resolve this detail, the president could simply tell his party's leaders in Congress to accept one of the nearly dozen amendments, like the Stupak-Pitts amendment, that does exclude abortion funding. The president also said that the federal conscience laws will remain in place. Well, here's an important detail. The regulations that would enforce the current conscience laws were suspended by President Obama just days after he took office. To take care of this detail, the president should again tell his party's leaders to accept one of the amendments, like Senator Coburn's or Representative Stupak's, which would protect the conscience rights of healthcare workers. The president said his plan would not increase deficits and that reducing the waste and inefficiency in Medicare and Medicaid would pay for most of this almost $1 trillion plan. Well, Mr. President, this really isn't a detail, it's more of a question. If there is this much waste and inefficiency in the government's present healthcare system, why do you need to create another government healthcare plan to clean up the current one? Show us first that the government can manage its money, or rather our money, then we can talk about creating another program that could potentially take over nearly 16% of the nation's economy. For more, visit frc.org.